today. I'm so excited. I have a visitor there. His name is going to introduce himself. Then after that, we'll continue. Esna, the clinician, like you know me. Don't forget to, as we continue watching, don't forget to subscribe, like and share. And if you have any question, leave it at the comment section right there. And then welcome and join us.
Oh, I'm Isaac Nyachio. I'm the visitor today.
Yes. As you have heard, Isaac is our guest, so he has a lot we are going to share and learn. So we'll give him time so that he can tell us what he really wants us to know today.
Today we are talking about UTI in general.
Mm-hmm.
Yes.
So UTI is a broad topic, and mostly people confuse it with STD, and most people don't really know what's that wherever you say UTI. And well, then somehow at a certain point you mentioned STD, and people are like, okay, doc, what's the difference? Mm-hmm. Now, before we jump to the topic of the day, let's differentiate the two. UTI is an infection that essentially affects the urinary tract system, while STD is purely reproductive and it's through sex. It is purely transmitted via sex.
Okay. I have some questions today for our doctor here. First, what is the cause of UTI?
Purely bacteria, but sometimes people suffer from, but it's purely bacterial if you can, but it can be caused by different types of bacteria, so you can't specify which one, but essentially UTIs are caused by bacteria.
Okay. And signs and symptoms of UTI?
So like we say, once we tell you have a UTI, first of all, there are some things that you have to complain about. One of them is that you have pain on urination. Another one is that you will have frequency. You'll be feeling that urge to urinate more often, and probably a little. You go urinate and then you come back, you sit a little and you feel like going. You can as well have burning sensation on urinating, low abdominal pains, backache, and other, in severe cases, you can see people having blood in urine. So that's purely what we call a UTI, and those are the symptoms, the major symptoms of UTI.
Okay. Diagnosis of UTI?
Clinically, you can diagnose UTI without even doing a test, but it's very paramount that you send a patient to the lab so that somehow at a certain point, because there are people who have recurrent UTIs, you can do a urinalysis, get bacteria, but then again you might be required to do a culture to certain patients because of the recurrency, and they have used so many drugs without them recovering. So you will have to do a culture so that you get the specific bacteria or the organism that the patient is suffering from, and you give the specific drug to such a infection.
Some of the prevention measures
of UTI.
Yes.
So one of those things that you should do so that you don't get UTIs is mostly UTI are caused by usage of those toilets, especially the ones in fact, we could say UTI are more common in females than in male. So you get that because of our anatomical structure, how ladies are made, they suffer more and they are prone to UTI than male, because two, our position, wherever we sit on toilet seats, but you men stand, at least you have that preference. But for ladies, if you go to a toilet that's very dirty and then you squat, then as you pee, that urine splashes back at you, you are prone to getting a UTI. So one of those things that we advise ladies, you rather stand as you pee, take that position, you are standing legs apart and urinate out. Don't sit on a dirty toilet that you know. And wherever you go to a toilet, flush. Make sure there's water, flush first before you use it, because you might not know the person who was using it before you came. Taking water is very essential as well, because once you get a UTI and immediately you get a UTI and you are not such a person who takes water, you are prone to that bacteria having room to harbor in you and then multiply so much. So what you are supposed to do as a person after you, during the day, try to take a lot of water so that you can pee a lot and flush the organism out, so that you don't give it time to multiply.
Is it advisable to take antibiotics whenever you feel like you have a UTI?
Ideally, even antibiotics prolonged use of antibiotic every now and then you're on antibiotic can predispose you as well to UTI. Because what happens is that the more you take antibiotics, the more you kill your immune. So this immunity that prevents you, especially the females, because female in their reproductive organ or the perineum, the vagina has its own mechanism of maintaining its pH. So the more you take antibiotics, the more you clear that normal flora in the vagina, which predisposes you so much to a lot of infections, and then you come to suffer from a condition called candidiasis. So that candidiasis, you might not be suffering as such, but because of the overuse of antibiotics, you have that itching and discharges, yet you are not sick as per se.
Okay.
Yes.
My last question before we end our topic
Yes.
is, can someone treat UTI?
They are treatable, yes, because they are bacterial. So, and most of bacterial diseases, they are completely treated. Completely. Using the right drug, they are completely treated.
What are some of the risks of UTI?
Age, like we say.
Okay.
Age is one. Sorry, not age, the sex of the person, because we have said more female are prone to getting UTIs than male. So sex is one of the things that we consider, because even whenever we are seeing our patients, outpatient, look at the statistics of how many patients we are seeing with UTIs. We will get more female than male.
Okay. Guys, thank you for watching.
So that is it for today, guys. Thank you for watching and joining us. Until next time, same place. Don't forget to subscribe, like, share, and please always leave a comment. It will help us to know the next topic we are going to discuss about, or an encouragement. Thank you and cheers.
Bye.
Bye.